inland parts of South Africa will not escape the full impact of the third wave. That's according to Professor Túlio de Oliveira, Director of the KwaZulu-Natal Research, Innovation and Sequencing Platform. This as provinces in the country, at least some of them, have entered the third wave. The Prof joins us now from Johannesburg to unpack this. Good morning to you, Professor de Oliveira. Always a pleasure speaking to you. I suppose there are going to be questions to be asked about the inland provinces not escaping the impact of the third wave. Was there ever a point, Prof, where perhaps the inland provinces were able to avoid this?
Okay, so yeah, to completely avoid it's quite difficult, yeah. But what one can try to do now is to minimize the size of the third wave, and that's going to be the very important job of not only the government, also the private institutions, to try to increase vaccination, also try to increase testing, contact tracing and isolation, and also from the public to really try to avoid in the next few days or in the next couple of weeks super spreading events. Because if we start moving from growing case to super spread events, we may go to that fast increase of cases, especially what we are seeing in the inland provinces, so more specific, the Northwest, Gauteng, the Free State, and the Northern Cape. They are the provinces that seem to be moving quicker to a potential third wave.
Prof, help me understand, we're now, it seems, for at least two of the provinces into this third wave. There are going to be critics of the way government has handled this, that surely by now we would have learned how to avoid moving into the next wave of COVID-19. We've had two of them. Is this just still too new a pandemic for us to understand exactly how it works, or are the processes in place simply not good enough, and we're going to keep on repeating this cycle of lowering restrictions going into a new wave, lowering restrictions going into another wave? Are we simply not learning as a country?
I honestly think that we learn quite a lot, and to be honest, you remember, and many of your viewers, that people were expecting the third wave by Easter or even before Easter. So at least it seemed that one could increase the space between the second and third wave. Of course, that what we know from the data is that the third wave is likely to be bigger in places that had a lower second wave. Yeah, why that? The reason for that is because the variant that we discovered in South Africa, the 501.V2 or the B1351, it releases very high level of antibodies. So provinces such as Eastern Cape, Western Cape and KwaZulu-Natal that have this incredible big second wave, they will be a little bit protected for a little bit longer from the third wave. And that's why, unfortunately, we are seeing this third wave starting in the inland, because many of these provinces, the population, when the second wave came around December, they were in the coast of South Africa.
Let's go back to a conversation that I'm sure you had with a colleague of mine roughly this time last year. Prof, if that's okay, there was always going to be the question of the increase in numbers in correlation to us going into autumn and winter, the natural increase in flu numbers and people's immunity being lower just because of the season we're in. Is there a correlation at all between the season and this increase in numbers, or is that simply not how COVID-19 works?
Unfortunately, what we are learning, that's not exactly how COVID works, because, for example, last winter, in South Africa, we are between waves, yeah, and we end up with a massive second wave in the summer. So one thing that we are learning is this process of decreasing natural antibody response of previous infection that lasts a few months, yeah, which, as we are learning, it seems to be around 5 or 6 months maximum, yeah. until the antibodies in a previous infected individual is lower, so cannot protect from transmission from a second infection. So that's something that we are learning. Yeah. One thing that we are also learning all around the world is that vaccinating, especially healthcare workers first, is really important, because then at least you can have the people in the hospitals that you need there to take care of the sick. So far, South Africa at least have vaccinated 500,000 healthcare workers with a good start. Yeah, I think that's going to be crucial. What starts this week is the vaccination now of the elderly. Yeah, and what we need to do as a country, it's at the moment is not really restrictions are normally the last resource. Yeah, so I think that we really have to try to avoid the super spreading events, and also increase testing and contact tracing and isolation.
Professor, thank you again for your time. I don't want to keep you too long, but I would love to put this question to you. I'm sure you've seen the reports coming out of India that the COVAX vaccine supply for 2021 has taken quite a massive knock because of the numbers in India. The numbers are terrifying, their daily infections. As a result of that, COVAX is about 140 million doses short to be able to export that to the rest of the world. You were just talking about vaccination and the importance of that. How damaging is the situation in India, which is affecting COVAX and affecting the export of vaccinations to Africa, A, and B, to South Africa? This is surely going to have a massive knock-on effect.
So I think the big knock-on effect, and before this interview to the eNCA, I just gave an interview to one of the 3 big channels in America, is that what has probably happened not only in India but also in America. This week was a lot of celebrations in America that young children were being vaccinated and that they could go back to play date and sleepovers. And I personally find that really sad that vaccines are not available in African countries, not even for healthcare workers or for elderly. And in other countries in the world, they are protecting the whole vaccination stock, even for people that do not really need vaccine at this phase of the pandemic. So we had a massive stock over of vaccines, a lot not only from India. India was one of the only countries that allow export of vaccines. For example, many countries in the European Union and North America say that they wouldn't export vaccines. For example, the UK, until they vaccinate the whole population. And that's what we want to highlight, that now we needed to treat this pandemic as a global pandemic, and that we cannot leave any country behind. Otherwise, we're going to have the appearance of new variants that can transmit much quicker, as it what's happened in India in the last few weeks.
Very worrying news coming out of India, the shortage of vaccines available for export. Professor, it's always a pleasure speaking to you. I thank you for your time. Professor Túlio de Oliveira, Director of the KwaZulu-Natal Research, Innovation and Sequencing Platform.